Second, we have questions of access, and we have a lot of uninsured people in this country. Now, again, I would add a little caveat because the numbers you hear generally thrown around aren't the most accurate in the world. The number you hear all the time, people mention about 45 or 46 million Americans without health insurance. Well, the numbers there are a little bit off. For one thing, let's say about those 45 million Americans without health insurance, about 14 million of them are actually currently eligible for government programs like Medicaid and SEPP, but simply haven't signed up for them. Now, we can argue about whether or not we should try to sign them up or not, but the question is, do we really need another government program to take care of them when they're not signing up for the government program we have? And another of those 45 million Americans without health insurance, about 8 to 10 million of them are not actually Americans. They're immigrants, both legal and illegal, who are not insured. And again, we can question about whether or not it's a good idea for them to be insured or uninsured, but there's a whole question of whether or not, we can get a government program that's going to get them insured, particularly many of them are working under the radar screen as it is. Trying to track them down to make sure they've got health insurance is going to be an issue. And the question of whether, it's a little bit misleading to say there's that many million Americans. And then finally, we should point out that most of the people remaining who are uninsured are actually uninsured for a very short period of time. Only about 15 to 20% of the uninsured are uninsured for 2 years or longer. Vast majority, or about half, a little less than half, are uninsured for about 4 months or less. Essentially, people cycle in and out of the insurance market. What happens is, because in this country we link your health care to your job, when you lose your job, you lose your health insurance. And for people at the low end of the income scale, they cycle in and out of the job market. And so they're cycling in and out of the insurance market. They're employed, they have insurance, they lose their job, they lost their insurance, they're unemployed for a while, then they get a new job, they get insurance with it, and they're back in the market, and they're cycling in and out. It's not that they were born without health insurance, and 80 years later they died without health insurance, and they never got to see a doctor in between because they've been uninsured the whole time. That's not quite it. We should also mention the fact that not being insured doesn't mean you don't have access to health care. You certainly have access to emergency care by law. You show up at the emergency room, you have to be treated. But in general, you also tend to get about the same amount of health care overall. You tend to get it later. There's problems in terms of going in to see people when you're sicker, when you're uninsured, and you tend not to get the same care of chronic illnesses and things of that nature. But in terms of the amount we actually spend on you, it tends to be about the same regardless of what income level you're in and whether you're insured or not. And finally, the quality, for all that we have this incredibly high ceiling in quality, it's actually quite uneven. Your chances of getting the standard of care if you go to a hospital is about 55%. About 45% of the time you won't. And that's irrelevant to your insured status. It doesn't matter whether you have the best insurance or the worst insurance, you're paying yourself, none of that matters. Basically, it's sort of a flip a coin type of thing in many cases. So we have too many people die from medical errors, there's issues in terms of quality. All these things need to be addressed. The question is, how are we going to address them? Well, let's see, before we start talking about what the candidates think about the issue, why don't we ask what the voters and what the public, what you folks tell us you think about the issues. The very first thing you tell us is that you think our healthcare system is broken. 73% of you think that our healthcare system either has major problems or it's in a state of crisis. 73%, almost 3 out of 4. Those are extraordinary high numbers. Can you think of any other things? People might say the banking system right now and things like that, but how many times, do you think the system is broken and get 3/4 of the people agreeing that there needs to be major reforms of the issue? One interesting thing, though, is you ask this question in every country in the world. I just did a study of countries around the world. In every country in the world, there are similar numbers of people saying that their healthcare system is broken, is in major crisis. Doesn't matter what type of system they have. They can have a single-payer system, a market-based system, something in between. 3/4 of them still say their system is terrible, we need to fix it. So that may be something endemic with the healthcare systems. But as long as you have 73% of the people saying the healthcare system is broken, there's going to be a lot of pressure on the politicians to come up with some plan to try to fix it. And when we ask what it is that's broken about it, the two biggest things that come up, and there's no real statistical variation here, is access and cost. Cost too much money, and we have all those uninsured people out there that can't get care, because we hear about that in the news media all the time, about the uninsured. Actually, it's amazing that the number of 30% say the access is the big problem, because most people are insured. 85% of Americans have insurance. They don't have an access problem, but they think it's the #1 problem because they're told over and over in the media about all the uninsured, so it becomes a big problem. And cost, they recognize cost as a problem because they're paying ever more money. You know, you asked them about the system. I think these next two slides are very illustrative of what's going on. Even in terms of quality, there's concerns. 54% of the public thinks that we have problems in the quality of health care in the United States. And certainly in terms of coverage, I'm sorry, it's 45% of the population thinks we have quality problems. In terms of coverage problems, it's 72% of the population thinks we have coverage problems. So in terms of the system, the healthcare system, the public thinks the system is broke and it needs to be fixed. But what about their own health care? No problems there. They're getting great quality. 83%, they're getting great quality health care, and 70% don't have any problems with access. So they're fine with their health care system. This creates an interesting paradox. What the public says is, fix the system, but don't change anything about my own health care. This makes health care reform very hard to do, because almost anything you do to change the system is going to change somebody's health care somewhere. So you create this contradiction where there's all this pressure to do something, do something, do something, and then when people put forward a proposal, there's an immediate reaction of, oh no, don't do that because it's going to change my health care, which I like pretty much. Public was asked, here's I think a fascinating poll. The public was asked about a variety of health care reforms. Do you favor this reform or not? If you look at this, their answer was yes. They were in favor of every health care reform proposal that was proposed. From the most free market health care reform proposal to the most socialistic single-payer health care system that was proposed, they said yes. They said yes to totally contradictory ideas. Remove the link between jobs and insurance. 86% of the people said yes, do that. At the same time, 81% of the people said make companies provide health insurance. Reduce regulation. 77% want to reduce the amount of regulations on health care. 54% of the people want to have a single-payer government-run health care system. You know, cognitive dissonance, anybody? But that's what you're hearing here is, in essence, a primal scream. This is people saying, fix my health care system. I don't know how to fix it, but do something. And what that means is the candidate who can come along and offer a clear proposal of how to fix the health care system, and who says, I'm not going to change a whole lot about how you get your health care, is going to be very successful in selling that proposal. Whether it's good or bad, that the public's not going to go into that much depth. They want to know the system's going to be fixed and that they're going to be able to carry on pretty much the way they are today.